Imagine facing the daunting reality of living your entire adult life under 4 feet tall, but deciding to change that against all odds. This is the story of Chandler Crews, a Maryland woman who underwent a highly debated and physically grueling surgery to add 13 inches to her height. What she looks like today is the result of incredible determination and resilience. Chandler was born with achondroplasia, a genetic disorder that is the most common cause of dwarfism. It affects bone growth, especially in the arms and legs, and is known for causing a short stature with disproportionately short limbs, a typical-sized torso, and distinct facial features such as a larger head and prominent forehead. This condition stems from a mutation in the FGFR3 gene, which slows the development of bones, particularly the long bones in the arms and legs. Although achondroplasia affects fewer than 50,000 people in the United States, it is usually diagnosed early in life, often shortly after birth. Chandler's case was no different. Unlike her parents and siblings, who all have average heights, Chandler inherited the condition due to a spontaneous mutation that occurred at conception, a common scenario for about 80% of children with this diagnosis. Growing up was far from easy for Chandler. She recalls how her mother constantly worried about severe health risks related to the condition, including the possibility of sudden death caused by brainstem compression and breathing issues like sleep apnea. Frequent hospital visits became a norm to address complications. These experiences led to frustration and confusion during her formative years. At 16, when she understood she would never grow taller naturally, Chandler made the bold decision to pursue limb-lengthening surgery, a procedure many consider controversial within the dwarfism community. The surgery involves a painful, costly, and risky process where the bones in the arms and legs are surgically cut and slowly stretched over months to encourage new bone growth. This procedure often sparks heated debate because some argue that it wrongly implies short stature is a problem to be fixed, while others see it as a means to gain independence and improve quality of life. Chandler candidly shared on her website how she never felt connected to her own body and wanted to change herself rather than wait for society to adapt to her needs. She also highlighted a divide within the dwarfism community, where some feel offended when others alter their bodies. Yet, she insists that each person's body is theirs alone and no one should judge their choices, even if they share the same condition. In August 2010, at just 16 years old, Chandler underwent her first limb-lengthening surgery on her legs. The method required cutting the thigh or shin bones and attaching external or internal devices to gradually separate the bone segments by approximately 1 millimeter a day. This slow separation allows new bone tissue to form in the gap. After reaching the target length, the device is removed and the newly grown bone is left to solidify, a process that demands careful rehabilitation. While exact numbers on the frequency of this surgery in the U.S. are unknown, it is performed both for dwarfism-related medical needs and cosmetic reasons, with the latter increasing in popularity. The high cost, often reaching millions of dollars, puts this out of reach for many. Fortunately, Chandler's procedures were largely covered by insurance because her surgeries were deemed necessary to correct medical issues like bowed legs, a condition where the knees curve outward, leading to joint problems and mobility issues if untreated. Describing the experience, Chandler calls it months of twists and turns, filled with blood, sweat, and tears. Her recovery after the first surgery involved rigorous physical therapy, including several hours of personal training 5 days a week and daily exercises to regain strength and motion. By April 2011, the devices on her legs were removed, but the journey wasn't over. She had to avoid putting weight on her legs for a month, then slowly relearned how to walk using walkers and canes until she could walk unaided by June. After successfully lengthening her legs, Chandler also decided to have her arms extended to maintain body proportion. Arm lengthening, which she had done at age 17, is equally important for daily functions like reaching high shelves, driving, or comfortably performing routine tasks. Unlike legs, which bear weight and tend to heal faster, the arms required a longer consolidation phase with cautious physical therapy focused on mobility rather than weight-bearing. After the arm surgery, Chandler gained 4 inches in length, which significantly improved her functional independence. She underwent 2 additional leg lengthening surgeries by age 19. Now standing just under 5 feet tall, she describes her new height as comfortable short, a blend of being short but more proportionate and capable in daily life. For context, the average height for women in the U.S. is about 5 feet 3.5 inches. Chandler openly acknowledges that her decision was not only about increasing height, but also about gaining full body functionality. No longer needing step stools, having easier access to driving controls, and simplifying personal care tasks that were once challenging. Determined to give back, Chandler founded the Chandler Project, TCP, a patient advocacy group dedicated to raising awareness about achondroplasia and supporting research into new treatments. The organization also offers crucial resources to families navigating this complex condition. Today, Chandler lives independently and manages her health with greater ease and less pain. She encourages others to embrace their own agency in managing their conditions, concluding with an honest and powerful message. The fear and reality of achondroplasia's serious medical risks are often overlooked or ignored, but living with it is a daily battle. Chandler rejects labels like little person or dwarf, instead describing herself simply as Chandler, a person with achondroplasia who is striving to live her best life and inspire others to do the same. But here's where it gets controversial. Should limb lengthening be seen as empowering or as sending a problematic message about self-acceptance and societal standards? Is pursuing such a painful and risky path worth the potential gains? Or does it reinforce harmful perceptions? What do you think? Share your thoughts and join the conversation below.